Reviewing the scientific literature to answer your questions about gender diversity, this is Classroom Psychology. And now here's your host, Dr. Cora Sargent. Hello everybody and welcome to Classroom Psychology. I'm your host Cora. Thank you so very much for joining me. It is wonderful to see you. You look great. Have you done something with your hair? Amazing. It's wonderful to see you get on in here. Grab yourself a cup of something. Let's talk about gender diversity some more. And in this week, oh my goodness, episode 12. Can you believe it? We are so far into this. But it is for some time now, 12 episodes. Are you kidding me? Thanks so much for jumping on in here. We got folks from around the world listening, from as far abroad as South Africa and New Zealand, from Norway to Canada to Ireland to the UK to Australia and the America. Amazing. Thanks so very much for joining me. It's wonderful to see you. And this week, like we do every time we come together, we take a statement made by a politician or a public figure, or maybe just somebody who likes to talk in this topic, and we take the often confident declarations they make for the questions that we know, or at least we hope they were intended to be. And this week, like every week, no different. Our question this week comes from James Esses, who is a criminal defense barrister and now a commentator, writer, and advocate on the impact of ideology on society. He was recently speaking at an event, the Battle of Ideas Festival, last year, I think it was, and it was filmed by World Right. And the whole event is available on YouTube to watch if you want to take a look. But this was James Esses speaking at that event. So here we have James Esses.
Now, my starting point is always this. I believe that it's perfectly reasonable to believe that sex is binary and immutable, and also to believe that those struggling with their identities deserve support, mental health treatment, and to be treated with respect. These ideals are not mutually exclusive. Secondly, it's that gender dysphoria, this debilitating mismatch between one's body and one's identity, is a mental health condition. And in the United Kingdom, in order to be able to transition legally or medically, you must be diagnosed with this. So that is the frame of reference through which I submit that we should approach this entire subject. And yet gender dysphoria is the only mental health condition that is treated by affirming the distressing thoughts inside somebody's head or trying to physically change their body. The treatment for anorexia is not to tell a patient that they are indeed fat and provide them with liposuction.
Thanks so much to James for such an interesting question, posed, as they often are, with a tongue-in-cheek this time, and a bit of confident declaration. We're going to take it for the question that we anticipate that it was meant to be, and we're going to try to see if we can't find an answer. Here, I think the question is, why don't we treat gender dysphoria as a mental health condition, as James describes it? Why don't we treat it like it's the thought or the belief or, the identity is the problem that needs fixing? Why don't we try to change people's identity? If it's causing them distress, why don't we try to ameliorate that by changing somebody's identity so that their identity lines up more consistently with the gender that they were assigned at birth? Well, let's take a look. And the reason, right from the beginning, this is kind of an interesting question to me. I knew we were going to get into this territory, and it's a little bit sticky, the territory, because we're really going to be talking about conversion therapy. Now, it's sticky because, a lot of proponents of these approaches wouldn't describe them as conversion therapy. So in a sense, it's a little bit disingenuous, but I'm going to try to treat the question generously, and we'll take a look at all the different kind of approaches that are designed to some degree, make the effort to change someone's sexuality or their gender identity. Now, we'll take a look at the sort of diversity of those approaches in a minute, and it does include things like gender exploratory therapy, which, proponents of that approach would definitely not describe it, I think, as a form of conversion therapy. And we'll take a look at that in isolation. We'll have a look at that too. Now, Fenity and colleagues in 2023, they wrote a very interesting piece in the Journal of Youth and Adolescence And they describe, I was looking for a really good description of sexual orientation and gender identity change efforts, right? This is the broad umbrella term for any effort to change somebody's gender and or their sexual orientation, right? And there are lots of different approaches that fall under that umbrella. And Fennerty and colleagues say that, it can range from formal, structured programs at formal institutions like a course at a church, medication, or medical interventions like electroshock or aversion therapy, to psychotherapeutic techniques, including counseling. And all of these approaches, what they have in common is just the sort of effort to either suppress or to change somebody's sexual orientation or their gender identity. It can be done in healthcare settings, including withholding access to gender-affirming healthcare, and it can be outside of healthcare settings from family members or from churches or from other, institutions. It ranges quite dramatically, but they all involve this pervasive effort to reinforce kind of cisgender and heterosexual norms. It's born out of kind of cis heteronormativity, this idea that, cisgender experience and heterosexual experiences are, typical, are healthy, and are desirable. And anything that is not that, like gender diversity or sexual diversity, is considered to be, undesirable, unhealthy, unwanted. So as we get started here, I did want to kind of link it to my own experience. I do that sometimes just to kind of bring it to life and to kind of, remind everyone I'm a part of the community that I'm talking about here. As if you couldn't hear that in my voice. as if you couldn't hear that. So I have not experienced any kind of conversion therapy, but I did experience something really interesting in the healthcare system. I have had a very good experience of healthcare. I transitioned 10 years ago or so, and I had to go and see a psychiatrist before I could be referred onto the gender identity clinic in London. And when I finally got referred, I then had to see 2 psychiatrists in London before I could have access to any kind of medical support for transition. And the first psychiatrist that I saw in London, I approached them extremely honestly about my experience. And I said, look, I don't know who I am or what I am. I'm still trying to work it out. But I know that I feel like a girl on the inside. And, my expression is, a little bit all over the place. How I express myself isn't quite there yet. I'm in a society that's really discriminatory. Every time I try and be a girl in the world and I'm overtly, obviously trans, the world sort of punishes me for it in one way or another. And I'm, worried about prejudice and discrimination. And so I try to hide. I'm looking for transition in a sense. I know who I am on the inside, but I need my body to change a bit in order to help me to be okay in the world, to feel confident in myself. And that's why I'm here for transition. So I wasn't in a super feminine space, right? I wasn't overly feminine in my presentation, somewhat, but not deeply. And the first psychiatrist that I saw, we had a really difficult conversation, really, really difficult meeting. One of the most difficult meetings I've ever had with a healthcare provider. And essentially what was happening was that he was saying, listen, if you aren't fully feminine, if you aren't typically feminine, then I'm not sure that we can help you. And I was like, I knew that this was coming in a sense. I've heard other people's experiences where, the healthcare system is so worried, so concerned about regret that they have you need to be sure, in inverted commas, about who you are before they'll give you transition access to any kind of transition related healthcare. And that's why you see 3 psychiatrists, right? Because you need not only, you need a second opinion even at the setting that you're at, right? You need a second opinion to make sure that you are sure. And my not engaging in like super stereotypical forms of femininity meant that this guy was like, I'm not sure that we can help you, because if you're not absolutely sure, in inverted commas, who you are, if you're not sure that you're a woman, then we can't help you at all. So you need to, you need to show us how much of a woman you are by being a woman in the world all the time. Bearing in mind that just exposed me to huge amounts of prejudice. We already talked before about, like, I got attacked outside my house, police in my living room, but this dude was like, you have to do that long before we give you any access to transition. And I was like, I said to him, listen, you're essentially like threatening to withhold medical support if I'm not stereotypically feminine enough for you. And he said, that's absolutely not what's happening here. And I was like, I think it is. I think it is. And I still think it was, because then when I left, I was like, I know what I have to do. The next time I go back, because I know who I am on the inside. Next time I go back, I have to convince them that I'm a woman. I have to be as girl as I can possibly be. And the amount of, we get sometimes accused, transgender women, of being stereotypical women in the world, right? Of having to be these kind of stereotypes, or even, accused of being parodies of women. But you got to bear in mind that the only way to get access to transition-related care is to do that kind of stuff. And I had to do it, And the next time I went back, I went to see my second psychiatrist, and he was much more happy to be like, all right, I can see what you need. Let's go for it. Although the second psychiatrist, all due sort of credit to him, he also wasn't that fussed about people being like stereotypical in any way. But the damage had already been done. So I experienced that, the sort of resistance to healthcare. And I think this idea is going to come up a few times. We have this problem in society and in the healthcare system that says you must be transgender to access any kind of transition-related healthcare, and you must be, discreetly trans. There's not really a huge amount of support for the massive range of genders that might, exist between and around the binary that, might also need some kind of transition-related healthcare. So when we have systems and tools set up to be like, oh, we must know for sure who is trans and who is not, you got to bear in mind that that's, again, this kind of, it's birthed from a cis-normative view of gender, right? Like, there are only men and women in the world. And yeah, for sure, maybe there are some people who need transition-related healthcare because they are women in the world, even though they were assigned male at birth, or vice versa. But there still, it still doesn't make room for these massive amount of kind of genders outside of the binary that might yet exist. So that's a real problem that we might need to solve. And I think it becomes really relevant when we come to talk about this topic here. But let's look at the literature around this kind of approach, this sort of, either from withholding healthcare all the way to like significant change efforts to try to change somebody's sexual orientation or gender identity. So first up, we need to know how many people are experiencing some kind of change efforts. Thankfully, the research is pretty good here. There's quite a lot of studies looking at, how many people experience change efforts and how many people experience sort of strictly conversion therapy. And it looks like roughly 15% of the population experience some kind of change efforts, and closer to 5% of the population experience conversion therapy more strictly, which I think is way more than I was expecting. So let's have a quick gander at a few of these. The Trevor Project, really big study, 34,000 respondents from across the US. It's the largest survey of LGBTQ mental health ever conducted. And it found that 2 in 3 experienced some change effort. That's a lot higher than a lot of these other studies, but it sort of depends on how you define some kind of change effort. But when you're talking about conversion therapy explicitly, that's about 5% in the study. Hayden and colleagues in 2021 took a look at Black, Latinx, and white transgender and gender non-binary adults, particularly across the US. They used the USTS, which is this huge survey of 27,715 United States adults. from across like Colombia, American Samoa, Guam, Puerto Rico, and US military bases overseas, as well as across all states of America. And they found that 9.7% of the population of like LGBTQIA people had been exposed to non-religious, and 5.1% on top of that were exposed to religious gender or sexuality change efforts. In fact, I think this is discretely gender change efforts in this study, which is about 15% overall of their sample. They were all 25 to 64 years of age, majority white, but only 70% white, still majority white participation, and about 51.7% were transgender women. So of those folks, about 15% had experienced some kind of gender change efforts. Veal and colleagues from 2022, they asked 1,380 participants. They said, has any professional, such as psychiatrist, psychologist, or counselor, ever tried to make you identify only with your sex assigned at birth? In other words, tried to stop you being trans or non-binary? They found that around 1 in 5, 19.7% of transgender and non-binary people who had spoken to a healthcare professional to access gender-affirming care reported lifetime gender and identity change efforts. And a further 10%, 9.3%, didn't know whether or not they'd received this. That's going to become relevant in a second, because while these rates around 15 to 20% of people experience gender change efforts, I don't know that everybody knows. These systems are not always overt. These services are not always overt in their intent and their aims, and I'm not sure that everybody always knows what has happened at outset or by the time they complete it. It's not always obvious, I think. We'll come to that in a second. Blaise next, and colleagues in 2022, a very similar study from Quebec in Canada. 4,980 participants, and they found that a quarter of participants, 25%, is quite a lot, experienced sexuality or gender identity change efforts. And fewer than 5% were involved in conversion services more discreetly. It's really interesting, isn't it? Like, while the sort of the proportion of people who have experienced some kind of change efforts ranges, it sort of doesn't range that much, from 15 to 25%. I think depending on how you ask the question and the culture in which the question is asked, maybe Canada and the US and Australia, New Zealand, different to one another, but clearly they're different to one another. So there are differences there, but about just 5% or a little bit less than 5% involved in conversion services. It seems that's a pretty consistent experience, which is really interesting to me. They found that 4.4% of the sample used conversion services, with higher prevalence rates among trans participants than among sexually diverse participants. Really interesting. So trans participants in the sample experienced conversion attempts, gender identity conversion attempts explicitly, by friends or acquaintances, by relationship partners or ex-partners, and by healthcare professionals. So more people experience conversion efforts than I thought. We're talking about broadly about any effort to change somebody's gender or sexual orientation, finding around 15 to 25% of populations experience that. And when it comes to conversion therapy proper, it's more like 5%. Really interesting. And one thing I wanted to draw our attention to is Blaise and colleagues from their work in Quebec, Canada. They looked at something nobody else had looked at before, as far as I can see. I can't see anybody else looking at it at all. And that's about consent and informed consent. So I think we have to be slightly cautious about the concept of consent here. When we talk about conversion therapy proper, I think often that is considered a form of torture, and it therefore, I'm not entirely sure it is possible to genuinely consent to that. But here we have folks, most of the participants in the sample reported having consented to, in inverted commas, sexual and gender identity change services. But That's only just over half of participants. So, while it is the minority, it is quite a big minority that didn't even consent to these services. But even to those who did, it was the service's objectives were only clear to 55% of those who engaged in those conversion to services, and to 30% of those who engaged in gender identity conversion services specifically. So when it comes to sexuality conversion, 55% of people who engaged in them actually knew what they were getting into from the outset, and 30%, only 30% of those who experienced gender identity conversion knew that's what they were doing, even when they started in those services. So the goal of conversion therapy only becomes known to participants often after being involved in the process. So the question of consent, of informed consent, like often people are not consenting. Often people aren't consenting in an informed way. And there's this sort of like moral question too about whether anybody can really consent to something which in many circles is considered, a form of torture. Now, you might think that me using the word torture is a little bit out of place here, or maybe too big for what's going on. But the reason that we use it is, it's in response to the work that's gone on around the impacts of these change efforts, which I suppose really is the focus of the question here. What if we were to think of this as a mental health condition in inverted commas? And if we were therefore to try to change somebody's gender identity or their sexuality to become more normative, what are the impacts of that on the people experiencing those services? What happens to people? It turns out that the outcomes of these efforts are not only like ineffective, not only do they not achieve their aims, but the outcomes on people's emotional well-being are quite profound. So let's take a look. So we have a content warning here upcoming. We're going to be talking about suicidality. We're going to be talking about self-harm. So please look after yourselves. Our journey starts with Fennerty and colleagues in 2023, this year. Now, Fennerty and colleagues looked at gender identity change efforts and sexual orientation change efforts in New Zealand. They found 124 participants who had experienced sexual or gender identity change efforts, and they controlled for age, for gender, and for material deprivation, which is essentially a sort of an indicator of financial well-being, basically. To what extent are people sort of disadvantaged financially? And they found that controlling for all of those, sexual orientation and gender identity change efforts were significantly associated with increased non-suicidal self-injury and increased the odds of planning suicide and attempting suicide by more than 2 times. It doubled the risk. Veal and colleagues then in 2022, looking at gender identity change efforts specifically for trans and non-binary people in New Zealand, they found essentially from their large-scale survey, they found about 610 folks who had spoken to a healthcare professional to access gender identity affirming care, and 120 of those had experienced gender identity change efforts at some point in their lifetime. All the participants here were 14 years or over. So it's quite a lot, 120 participants, and they regressed those. So they did a regression, basically using experience of gender identity change to predict emotional well-being through what was the psychological distress scale that they had. Now, the psychological distress scale basically places people in one of 5 sections, 4 categories rather: none or low psychological distress, moderate psychological distress, high psychological distress, or very high psychological distress. It pushes people into one of those 4 categories. Now, what they found was that experiencing gender identity change efforts on average, pushed somebody into one higher of those 4 categories. So if somebody started in the moderate category, then gender identity change efforts would push them into a high category. It was able to predict a move up to one category higher on the psychological health outcomes on the psychological distress scale. They also found that gender identity change effort exposure predicted a 2 to 4 times increased odds of reporting non-suicidal self-injury, suicidal ideation, and suicidal attempts. Interestingly and importantly, the work, highlight that not only are these statistically significant, but these are clinically significant effect sizes, right? So the odds are, it's not just a question of like having a large sample size and overpowering the study. These are effect sizes that highlight a clinically significant change. Now, importantly, Hayden and colleagues in 2021, they were particularly focused on getting a properly representative sample of the US population. So they deliberately recruited from Black, Latinx, and white populations. And they found that across these groups, gender identity change efforts was associated with an increased odds of suicidal ideation and attempts, and that non-religious gender identity change efforts were specifically associated with severe psychological distress. Next up, we have Del Rio Gonzalez and colleagues in 2021. They looked at gender identity change efforts and sexual orientation change efforts among adults in Colombia. They managed to get 4,160 sexual and gender minority Colombian adults to respond to a survey. And they found that sexual orientation and gender identity change efforts were associated with, experiencing those were associated with a 69% increased odds of suicidal ideation, 55% increased odds of suicide planning, and a 76% increased odds of suicide attempts. Again, we're just finding the same thing over and over again across the world, that sexual orientation and gender identity change efforts are associated with negative outcomes. Finally, we have Lee and colleagues in 2021. Lee, Streed, Yi, Chu, and Kim, sexual orientation change efforts, depressive symptoms, and suicidality among LGBT adults, a cross-sectional survey in South Korea. This is specific to sexual orientation change efforts, but still really interesting from South Korea. Cross-sectional survey, 2,168 participants, and they found that essentially those who had undergone sexual orientation change efforts showed a 1.4 to 2.35 times higher prevalence of suicide ideation and suicide attempts. So pretty consistently, we find that gender change efforts or efforts to change somebody's gender identity do something similar to what efforts to change somebody's sexual orientation do. And that is cause significant psychological distress. I realize that people here might be sort of a bit cautious about the correlational nature of these studies and making claims to causation. And I appreciate that. I appreciate that. The alternative is that people who are more distressed seek change efforts like this. And I think maybe I've been reading some work that highlights that maybe both things can be true, that people who are more distressed might seek more change efforts, who are in less welcoming, more significantly sort of critical or oppressive environments might be more prone to seek change efforts. And it can also be the case potentially that change efforts might also yield these kind of negative outcomes themselves. I think it's probably more likely that the latter is happening than the prior, but possibly both are having a contributory effect. And why do we think that's the case? Well, in 2013, Wallace and Russell predicted that this would be the case in terms of gender change efforts. They basically said that, any attempt by mental health professionals to make people's gender more typical of their gender assigned at birth, of their sex assigned at birth, would be at risk, in inverted commas, this is a direct quote, at risk of fostering proneness to shame, a shame-based identity, and vulnerability to depression. So Wallace and Russell predicted this, 10 years or so in advance of these studies, suggesting that gender identity change efforts will cause shame. And shame, feeling shame about who you are in the world is a terrible, terrible thing to experience and leads to really negative mental health outcomes. Now our journey brings us to gender exploratory therapy. If you are a psychologist out there working, you may well have come across this concept. I mean, even if you're just a member of, my beloved gender diverse community out there, you may well have come across gender exploratory therapy before. And it is a complicated and quite diverse approach. There's a really good study. It's not even a study, it's a commentary paper, but it's quite a long commentary paper and it is quite in depth. It's by Ashley published this year in Perspectives on Psychological Science. It's called Interrogating Gender Exploratory Therapy. Now, if you are interested to learn more about gender exploratory therapy and the critique of it, essentially, do take a look at Ashley's work. I read it and I really enjoyed it. I thought it was a very interesting commentary paper. And I get the sense of how controversial and how challenging this approach is to fully understand, because it really isn't an approach. It's a sort of, it stands against gender affirmative care and, highlights itself as a sort of ethical, non-affirmative approach and a gender-free, neutral therapy. And it's deliberately contrasted against kind of gender affirmative approaches, which proponents of the model, like D'Angelo, describe as, says that gender affirmative approaches are political and agenda-driven, driven by gender ideology. I don't think that's D'Angelo's words, but it's something you hear a lot. That gender identity ideology is what's driving gender affirmative care. And it's political and it's problematic. And it's also driven by a view that gender identity isn't always evidence of somebody's sense of their gender identity isn't always evidence of their gender identity in truth, but actually their confusion, in inverted commas, can be driven by unprocessed trauma, childhood abuse, internalized homophobia or misogyny, co-occurring mental illnesses, social contagion, autism, sexual fetishism, or unconscious drives. This is all Ashley's words, but she's citing from a range of sources here. And I think that has to be, I've heard Sajid Javid talk about this, we have to be cautious here about gender identity because, people can be confused by some of these, mental illnesses, or they can be confused by abuse or trauma in their past. And those things need to be thought about before we can think about transition-related healthcare. And I'm sort of interested by that. I'm not sure what the evidence is. So we're going to take that as a topic for a future episode, I think. We're going to ponder, can gender identity be shaped by trauma or by abuse or by, unconscious drives? I guess we'll have to find out from the literature. But gender exploratory therapy is sort of designed to attend to those things, right? It's designed to say, well, actually, people's gender identity could be the consequence of these things, and therefore those things need to be explored long before we ever approach transition. So the core tenet of the model of gender exploratory therapy is to deliberately refrain from transition-related medical services, refrain from any transition-related care or affirmative model of care until they've gone through the gender exploratory, in inverted commas, therapy. In fact, I think it even goes one step further. The Gender Exploratory Therapy Association writes that psychotherapy should be the first-line treatment for all cases of gender dysphoria, and that transition-related medical care should be avoided if possible. Now, reviewing the literature, Ashley finds that while there is a literature on gender exploratory therapy out there, it is quite commentary in nature. It's a commentary, as is Ashley's own work, to be fair. And it focuses predominantly on criticizing gender affirmative approaches and defending the need for a psychotherapeutic gender exploration for the reasons that we've already highlighted. But it sort of discusses that, the need for an alternative and the presentation of an alternative, but it doesn't describe exactly what that alternative involves. It talks about why it's needed, but not exactly how it is done. And the details of what exactly goes into gender exploratory therapy are quite scarce. Now, this is a bit of a pickle, right? Because it's very easy then to defend gender exploratory therapy as completely benign, a sort of necessary or at least helpful review of a person's sort of psychological experience and the efforts to support somebody's psychological functioning in all other domains, and efforts to kind of refrain from transition unless it's actually necessary for people, and then to support it. It sounds in that guise like a bit of a watchful waiting approach, right? We provide psychological support while we're waiting to see whether transition really is the right choice for this person. And that sounds pretty benign. But as we've seen from Blaze and colleagues, right, gender identity change efforts specifically are often not obvious. Only half of participants in their study actually, just over half participants consented to the conversion services they were a part of, but only 30% knew at the outset what the goal of that service was, that it was to change their gender identity. So the risk here is that, gender exploratory therapy as a sort of, in inverted commas, needed alternative to the affirmative care model, but without any actual modality behind it, without any clear sense of what gender exploratory therapy must include and what it mustn't include, and without any real kind of clear guidance, without any oversight, what we end up with is a situation where there could easily be gender identity change efforts happening under the guise of gender exploratory therapy. And that's the real risk here. And that's why in the UK, we need a conversion therapy ban. We need the government to step in to say, this is what we consider conversion therapy. Gender identity change efforts are not welcome here, and therefore they are banned under the law. In fact, what we find is that the conclusions of all of these authors, Lee and colleagues from South Korea, saying strict legal sanctions that prohibit sexual orientation change efforts are needed in Korea. We have Del Rio Gonzalez saying the study findings highlight the need to design and implement policies affirming diverse sexual orientation and gender identities in Colombia, and to ban sexual orientation and gender identity change effort practices. And Fenety from their work in New Zealand highlights that this is particularly the case for young people who face additional challenges when exposed to sexual orientation and gender identity change efforts, as adolescence is a time when their identity is developing and consolidating, and they're particularly prone to the possibility of experiencing shame about who they are in the world. And therefore that, sexual orientation and gender identity change efforts that try to change identity at that critical period of development might be particularly harmful. In the UK and across the world, we need laws in place to prohibit gender identity and sexual orientation change efforts. We need laws to prohibit conversion therapy, because as we can see, services that provide it don't always make it explicit that's what they're doing. And when people experience these change efforts, it often leads to a very significantly increased risk of negative mental health outcomes, whether it be about psychological distress, whether it be about non-suicidal self-injury, whether it be about suicidal ideation, whether it be about suicidal attempts. This is why affirmative care is so important, right? That as young people and as adults come to understand who they are in the world, we need to be able to say to them, you're welcome here. Wherever you land on this diverse gender spectrum, you are welcome here. We are going to listen to you. And if you tell us that your experience of your identity is a particular way, then we'll believe you. And we'll welcome you into a community where everyone can find a place to belong. Thank you so very much for joining me. This is Classroom Psychology. You are very, very welcome here. And I look forward to seeing you, as always, in the next one.